we look at kids' growth and development, we look at really certain factors: fine motor skills, gross motor skills, right? A little bit of thinking and a little bit of communication. Is that true?
Sure.
So we sort of look at them individually, but we look at the overall picture.
Right.
Some kids grow mentally in some areas quicker than some other kids. Doesn't mean there's something wrong with your kid, but if all of them are behind, there's a little bit of red flag. We looked at it in a particular way. And we're going to try to go through the key areas of development at different ages. Mm-hmm. And if you find something the kid isn't doing, right, doesn't mean there's a problem. It just means that we're aware of it. It should be followed by your pediatrician. You agree?
Yeah.
And like my brother didn't walk till he was 2. He invented word processing. Mm-hmm. Albert Einstein didn't talk till he was 4. Far as I know, he was a pretty smart guy.
Right.
Never had nothing to say. He was just thinking in his head. So you can't go by that. Obviously, the more things are falling behind, the more chance there's a problem. Is that true?
Yeah, and all children develop at their own rate, and there are some guidelines based on the general population that we follow. And when we see that your child's falling significantly behind in certain areas, that would be a time when we would start, investigating and just following him, maybe doing some interventions that would be necessary depending on which areas he would be suffering in.
If you went by a newborn nursery, and I heard you say that before, the first thing you do, you observe.
Correct.
And what would you be looking for if you saw a kid in a newborn nursery, say, this is probably, without examining the kid, probably a pretty healthy kid? What would we be looking for?
So the first things we do is really just look at the child, look at his position in the crib, how he's holding his body, how he's holding his arms and legs. And one of the most important things is seeing that he's moving all his extremities, both his hands, his legs, in a normal fashion and symmetrically. Whenever we see something very asymmetric, that he's always moving one side much more than the other, or always turned to one side, those are signs of concern that maybe one side of the body isn't developing as well as the other. But as long as everything's moving, there's a normal repertoire of movements, these are things that are reassuring.
Sometimes a baby, they shake a little bit in the nursery. You touch the crib, mm-hmm, they jump, and those are usually called benign tremors. But if they keep going on and on and on, it could be something wrong with maybe electrolyte or calcium's a little low, sugar's a little low. But mm-hmm, generally, you see some tremors in a kid, you watch it, and usually dissipates. Is that true?
Yeah, there are all sorts of abnormal movements in children, and a lot of people are afraid these abnormal movements are seizures, and sometimes they can be seizures, but not all abnormal movements are seizures, and that's something that a neurologist would really need to be involved in to evaluate properly.
And if you pick the kid up by the hands, there's a lag on the head. Is that true?
Yeah, as when the baby's first born, they have very poor head control, but as they get older, even within the first month or two, they really start developing much better head control.
And the other thing you look at is the color.
Mm-hmm.
Some babies can turn blue because they're cold, but if the kid is warm and comfortable and not crying, you look at the kid's color. Mm-hmm. It's part of the general appearance. Is there anything else you would look at a newborn that say, oh, this kid is okay, or a problem that you're looking at?
Oh, you want to make sure that they're eating properly, they're able to suck well, the muscles in their cheeks are developed, the coordinations are developed like that, and that they're consolable, they're not just completely crying without being able to comfort them. And a baby should be able, and all these are signs that the baby's healthy.
Bonding is very important. Can a baby really tell a C when they're born?
It's very difficult to tell, obviously, how much a baby sees or doesn't see. It does seem that they don't see as clearly as we do, and maybe just see some forms and colors. But babies can see from when they're born.
I saw a study once where they took a circle, a square, and an oval on babies, and I found they actually fixate more on the oval, like a human face, than they did the other things. So they probably see some shapes. I don't know if they see any color when they're born, but they certainly fixate on an oval, which could match a mother's face. And that bonding is very important, isn't it?
Oh, of course. I mean, we have a special area in our brain that is focused on just seeing faces and recognizing faces and storing those in memory. And a baby recognized from early on who his mother's face is and his father's face, especially the mother's face. And they use this for their own comfort level. There have been lots of studies where babies will often, a lot of parents notice this in their own children, when there's a new environment and a new person walks in the room, they'll always look at the mother's face and get an idea if the mother's worried Or if she's happy, and if the mother's happy, the baby will usually be comfortable and happy. If the mother's worried, the baby will start being anxious.
Yeah, a new mother's very nervous, and sometimes they hold the baby, and they're so nervous, their hands are shaking.
Right.
You're telling the kid, I'm an amateur, and the nurse who's fed 20,000 babies holds the kid with comfort, security, and the babies don't cry. They know.
Right. And a lot of that is just the parents need some reassurance from their doctors and from those around them, their mothers or sisters who may have already had children. A lot of first-time mothers are very nervous, and it's understandable. It's a very big responsibility, and you don't always know what you're doing. They don't come with manuals, obviously. But babies are, pretty easy to take care of once you're comfortable with yourself and you're comfortable with the child. And it's just a matter of holding them, feeding them, and the newborn period can be it's just really a matter of enjoying them.
So the first time we touch that baby, we set a little bit of that information to the brain.
Sure.
I'm a professional. I know what I'm doing. You stay calm.
Right. And the baby can sense a lot of that just by the facial expressions, by the smells that he smells, and they can really tell what's
But
happening.
a good observation really tells you from an experienced pediatrician that this is probably a pretty healthy baby.
Sure.
More than just the examination, just how that kid looks.